Hey guys, happy Friday. Welcome. Sorry we're a little behind. Dr. Downs was in the OR, so unfortunately sometimes we're on his schedule. Anywho, so today we're doing what's the #1 wrinkle fighter. And I know you guys have been like commenting like sunscreen, which is fabulous. Great job if you're using that sunscreen. H2O, another good one. But actually the #1 wrinkle fighting is BOTOX. How awesome is that? So today we're going to be doing a BOTOX procedure, and it's great leading up to that spring fling, so you guys can definitely see that procedure. It will be a demo on stage. So today, BOTOX #1 wrinkle fighting, and if you have any questions, as always, please comment below and we will ask them. All right, let's get to it today. Well, hello. What's going on?
Good afternoon. We're ready to do a little BOTOX.
I blamed everybody that you were late. So.
You blamed it on who?
You.
Okay. Good. So, BOTOX is probably one of the things that we do really frequently here at Center Yourself Medical Rejuvenation Spa.
And a #1 wrinkle fighter.
It is a wrinkle fighter, and I think there are a couple myths we need to shatter when it comes to BOTOX. So, a lot of people think, we offer fillers, we offer BOTOX, and a lot of people get them confused, and it's very, very common. Don't feel like you're crazy if that happens to you, because it's a very common issue. So fillers are designed to do exactly what they say: fill tissue, restore volume. BOTOX does not do that. BOTOX is what we call a paralytic agent. It paralyzes muscle. So BOTOX comes from botulinum toxin. So botulism, Clostridium botulinum is a bacteria that creates what's called an endotoxin. In the world, that bacteria is very dangerous because of this endotoxin, because that's what gets into rancid food or bad food, and then you get botulism. And what that is that it's a paralyzing kind of endotoxin that gets in the human body. It's very toxic and dangerous. So a lot of people think, well, if that's the case, I don't want BOTOX, I don't want anything weird in my body. Well, BOTOX is not manufactured like that. BOTOX is manufactured from a recombinant DNA type of process where it really does not involve the bacteria itself. So the toxin is not dangerous at all to humans, but it has all the effects of the paralysis. Paralytic agent work, it has to have a nerve. A nerve has to fire that muscle. And what BOTOX does is it gets in between the nerve and the muscle, and it blocks what we call the synapse. It blocks that connection. It doesn't let the nerve tell the muscle to fire. So most of the wrinkles in our face have to do with not only aging skin or damaged skin, but it comes from muscle pull. Many of them do. So what we do is we know where all the muscles of the face are. So when we start to think about where we're going to affect a change on the face, a lot of it has to do with where these muscles are. So the most common places are areas that create a muscle pull, yet aren't vital to the function of our face. For instance, we don't want to put so much BOTOX in a person that we've paralyzed the majority of their muscles of facial expression, and then they can't animate. They can't make facial expressions. They look kind of deadpan. By the same token, we want to paralyze the muscles enough so they don't create wrinkles. The most common areas are in the forehead and eye area. Now, BOTOX is really FDA approved for the use of periocular wrinkling, not forehead, but we use it in the forehead in an off-label kind of fashion, and same thing with the crow's feet. So a lot of times we will limit our BOTOX treatment to this upper third of the face. Sometimes, as you can see, there are muscles elsewhere that sometimes we will affect a change in to try to do different things. For instance, there's depressors of the corners of the mouth, where the little areas, your corners of your mouth can turn down. And then there's elevators of that.
Now, I have a question. So one of the big myths I get is, how can you spot fake BOTOX?
BOTOX?
Also known as like China BOTOX. How do you know when you're going into a place if they're using actual BOTOX or not?
You can ask to see the bottle.
What is it?
If we have do we have a bottle here? So BOTOX, the brand name BOTOX is manufactured by a company called Allergan. And Allergan is where we get all our Botox from, because we use Botox. This would be the bottle, and it all has lot numbers. Every lot number is registered and can be tracked back to the manufacturer. There are other preparations of botulinum toxin. Zeamin is one of them. It's manufactured a little bit of a different way in terms of the linking proteins. Dysport. So there's a number of different botulinum toxin manufacturers that are out there and are very good botulinum toxin. You have to get it from a manufacturer that's where it's under FDA control, and that's what this is. So if you're worried or you're not in a place and you can see, there's a brand name on this, so you want to make sure all the lot numbers are. And most reputable places won't use the black market Botox, if you will, because there's no control over that. There's no control about the purity. There's no control on the dosage or how much you're actually getting, and some of it can be just downright not good, and dangerous. So you want to make sure that that's the case. So getting, and it's kept refrigerated, and there's certain procedures that we adhere to, just like any other injectable that you have to make sure are followed. But getting back to my corner of the mouth thing, so muscles have different pull. So if we know the corner of our mouth is basically positioned by the little tug of war between these two muscles, if I weaken one of those muscles, the other muscle wins. So if I have a depressor and elevator tugging war here, and then I weaken the depressor a little bit, my elevator wins a little bit. So I can turn the corner of the mouth up by hitting that muscle. So it's a little bit of a science. Sometimes you get that overactive chin muscle. You can knock that down a little bit. There's a platysma muscle in the neck, creates these little bands under here. Sometimes we can paralyze that and loosen that up a little bit and improve those bands. Same thing with the orbicularis of the eye, crow's feet. When we squint, this muscle contracts, creates those crow's feet. We can microdose out here and just paralyze a segment of that muscle and stop those crow's feet. Sometimes we can come down for the eyebrow. Sometimes we can come right up underneath there, get a little bit of Botox in that part of the muscle, elevate the lateral brow. So you have to have an anatomic knowledge of where the muscles of the face are. You just don't go in, you're not injecting it into a wrinkle. You're injecting this into a muscle that's causing the wrinkle. And therein lies the big distinction between some people that know what they're doing when they're putting Botox in your face versus someone who doesn't know what they're doing when they're putting Botox in your face. And as you can see, here's your forehead muscle. Now, if you come in, now everybody that walks into your office, you don't want to paralyze their frontalis muscle, because a lot of it depends on where your brow is sitting. So these are all things that you have to evaluate when you look at a person who just comes in for Botox. You just don't come in and willy-nilly start hitting different muscles all over the face, because you can cause more problems than you're helping. So, for instance, if we look at Jessica, our subject for today, the first thing we're going to do is we're going to get her to animate. So I want you to make like a mad face. So you can see she has very strong corrugator pull. That's these two muscles that pull in, creating what some people call the 11s, the mad wrinkles. Then you can crinkle up your nose. That's a muscle here called the procerus muscle, and those create these wrinkles. Those are different muscles than this. What she's doing right now is she's activating her frontalis muscle, pulling her brows up, creating these wrinkles across here. Now, she doesn't like those. She's starting to see the lines showing up from those wrinkles, so you want to knock down the function of that frontalis muscle a little bit. So as we start to think about that, we go back to our diagram and say, okay, we're going to spot treat this frontalis muscle, but we don't want to we want to be very careful where we do that. Why is that? Well, there's a nerve that comes up here called the frontal branch of the facial nerve. We don't want to paralyze that, or it could actually paralyze some of the orbicularis. So typically we won't go too far lateral. But if we're not careful, and you just do medially and not do something over here, then when they elevate their eyebrows, they look like Mr. Spock from Star Trek. So we want to make sure that that doesn't happen. So you have to start thinking about all this stuff in your mind. So we're going to lightly treat her forehead. We're going to treat this procerus muscle. This is the one that crinkles up her nose. And then these two muscles here are called the corrugator muscles. Those are very commonly treated. The corrugator muscles are a little different than any other muscle in the face. They're innervated from underneath. So we have to actually go deep for that. But the rest of them are basically just an under-the-skin injection. We're going to come over and do her crow's feet area here because she's asked to do that a little bit as well. Because when she smiles, she's starting to see a little squinting action over here. So we're going to be very careful with that. And so our plan is to inject the corrugators, the Proceras. We're going to just lightly treat her forehead because she doesn't have real heavy lines there. And I don't want to completely knock out the animation. Now her brows are sitting in a nice position. They're above the orbital rim. If you feel her orbital rim, it's here. Her brows are above it, and that's where they ought to be. If you have somebody who comes in and their brows are down here, and they're really heavy brows, and they have these, and this is what typically will happen. A person will come in and they have these terrible lines on their forehead. They go, I want Botox in my forehead. And we look at them and you say, well, your brows are down. I don't care, I want these lines off of my forehead. Well, the problem with the brow being down is if I paralyze the muscle in her forehead, the brow's coming down even further. The whole reason those lines are there is they're trying to overcompensate for where the brow position is. So they overcompensate by walking around voluntarily holding their brows up, creating these lines. So you have to be very careful on those people not to treat. That person might need some sort of brow lift more than Botox in the frontalis muscle. So you have to have that skill set. So it's really, you know, it's like in today's day and age, you can go almost to, you know, any street corner and get, you know, put your Botox injected. I mean, there's a lot of practitioners out there that are putting Botox in people's faces, but you have to be careful because it's more than just injecting this into a wrinkle. It's about knowing about facial anatomy. It's about knowing what the counter pull of the muscles are. And it's about knowing where all those nerves live. And that's the important, that's the kind of basis for Botox. So I know that's probably a little more technical and a lot more information than a lot of people want. They just want to see Jessica get injected. But those are the things that are going through our minds before we inject Botox. And you should take, when you go in for Botox, if you've never had it or you don't know the person doing it, you want that person to take a couple minutes of their time to go over that chart, go over your face, explain to you where they're going to put the Botox and what they're going to achieve by that. Make sure that they tell you what they're going to achieve by it, because what their idea and what your idea might be are two different things. Don't let somebody just tell you, you know, you tell them what your areas of concern are, and that's how you want to proceed with Botox.
So we have a question. So Lisa wants to know, once you start with Botox, how often does it need to be done? Botox
will typically last, if injected correctly, it usually lasts about 6 months. That doesn't mean you need to be re-injected every 6 months. You don't, the idea there is not to let that muscle pull come back. So we recommend, if you are going to embark on Botox, unless you're just doing it for a one-time deal, hey, I have a wedding, I'm going to look decent, fine. If you're going to do this on a regular basis, either to treat wrinkles or even be in a preventative treatment for Botox, we recommend every 3 to 4 months. You want to dose before the muscle pull comes back. You don't want to wait till all the muscle pull comes back and then come back and get redosed. Two things. One, you're not helping the wrinkles, but two, you're going to need more Botox. Because if when you initially have nothing on board, you're going to take more to get that initial treatment, and then every 3 to 4 months you can get retreated, but you won't take as much Botox on those retreatment times. So every 3 to 4 months.
Yeah, the more you're consistent, the not as expensive it is, because that
can be charged by the unit.
Correct.
So I'm going to switch, Shannon, I'm going to switch places with you.
Okay. Catherine wants to know, once you start this, is this a lifetime treatment?
Doesn't have to be. Does not have to be. There's no rebound. For instance, if we stop the Botox, you're going to look, 10 times worse. It's just something that's a preventative thing. And a lot of it depends on how bad how bad things are. She doesn't have very many wrinkles. I mean, what's bugging her is some of the crow's feet. What's really bugging her is that, because she keeps doing that, and eventually she's going to see that as she gets to be my age.
But Jessica has worked here for over 10 years, so she's been being preventative as well.
Have you had Botox before?
Yes.
You have? When was the last time you had Botox?
When's the last time you did
it? Okay. Okay, so this is a little alcohol. We're going to clean. If you're going to get Botox, do your practitioner a favor. Don't wear too much makeup. She doesn't have a lot of makeup on, because we're just going to make you look ridiculous by wiping it all off. Okay.
And the cost for Botox, I know that's a question, is $13 a unit. And you're going to explain the units when you do it.
Well, it depends on the dilution. You know, different practitioners will dilute to a different level. So it's typically about a unit, a tenth. So a tenth of a cc is 1 unit. So, and I'll explain as I go typical dosing patterns for this type of thing. So for her corrugators, it's a heavier muscle. It's going to take a little bit of a higher dose. We typically will inject 2 times in the head of the corrugator, usually about 2.5 in each injection. So, okay, close your eyes, make a man face. So I'm looking, there's the max pull of her corrugator is right there, relax. Put my finger up against her orbital rim so I don't get any spread, and I'm going to go right down to the bone, and you can hear that, it doesn't hurt.
Sometimes you have that crunch.
And I'm going to put that 2.5 in there, upper part of the head, another 2.5. And I'm going to just hold for a minute. Now the reason I go down to the bone, and that sounds gross, but that's where the innervation of that muscle is. That's me. Now what I don't want that Botox to do is seep over to here. There's a little wispy muscle that helps her elevate her eye called the elevator muscle. We don't want any Botox there because then you'll get a lid droop. A little 2.5. 2.5. Can you hear that?
Mm-hmm.
Yeah, you can hear it.
So now you've done 10 units.
Right.
Okay.
And I just hold it there a little bit. Math wasn't my strong point. So that's the only one that really goes deep like that. And sometimes you get a little punctate bleeding like that's normal. So this one we just go underneath the skin, just like that. And then I do right there. That keeps them from getting those little bunny lines that people hate.
So right there you did what?
Another 2.5, 2.5.
So you're up to
almost 25 units at this point. That's it. Wait a minute. Did I add right?
No.
5, 10, 15
15.
units. Sorry. Yeah, because I had some left. I was just going to say. So typically we'll do 15 or 20 units in the T area. Now I have I have a little bit left in this, so I'm going to start up her forehead. Now I know that there's nothing in the middle, no muscle right here. So don't inject it. You don't have to get somebody's injecting the middle of your forehead. You're paying for Botox you don't need.
Mm-hmm.
So what we'll do is we'll come over here, and we see the wrinkle, but we know, and I'm not injecting the wrinkle as much as I am the underlying frontalis muscle. I'm going to put about 2.5 there. Same place on the other side because we like to be even. 2.5.
Someone wants to know, do you put Botox underneath under the eye bags?
No. We never go, I don't like to go too far under the eye because it paralyzes that muscle and then it gives you the fisheye look.
What's the fisheye?
The fisheye. It's this. It just droops down when you do that.
No good.
No bueno. Again, this little muscle's like a fan, so we're going to put a little.
So I just had 2 questions on it. So guys, no, he does not go under the eyes, but he will do the crow's feet, which we'll talk about next.
I'm going to do that next.
So maybe that's where.
So now I'm not going to go any farther lateral on her forehead other than what they call the mid-pupillary line, because I know that this nerve comes right up here. Okay. But I will what they call microdose, and this is, you know, and give away some of our trade secrets for all you would-be injectors that are watching this. But we can microdose right here because I don't want her to look like Mr. Spock.
What? Jess, I thought that's the look you were going for.
You know.
No, it's not that's not the look I want to. That's not what I want to look at every day when she's working here. She's like, look at my eyebrows. You've messed them all up.
Look what I can do.
So just to let you guys know, we are his worst patients. So how many units have we got, Kat?
So I did 2.5, 2.5, 2.5, 2.5, 2.5, that's 15. I did 20, 25. I'm at 27 units right now.
Okay.
If I'm counting correctly.
So
Now for the eye crow's feet, I want to microdose right along here. And I will come a little bit down to here, but not much further, because she has these lines that are starting down on her cheek. Sometimes you can do multiple injections. I like to do a little bit of a different technique when I do my Botox, only because I don't like to keep jabbing. That skin is very thin here, and there's veins, and there's a higher likelihood if you're going to get a bruise, it's going to be lateral to the eye. So I pinch up the skin a little bit, and because again, I'm just layering this under the skin, and I actually fan it down. And I'll actually massage this, because I don't care if I spread this around just a little bit. The only place I don't really want it to spread is right there.
Just grab her nose.
Grab her nose, pull it over. Okay. And that's nice. It leaves a nice little, you just get one poke. That's a little tender area too, right? I don't know by the eye.
Lisa, I'm excited for spring fling too.
So these are the ones I want to get. And it's a microdose because I don't want a fisheye appearance. So I'll come under there, maybe 1 unit there. Spread that around a little bit. And 1 unit right there.
But you see, you guys, he's coming outside the eye, not under the eye.
I'm not going right under the eye. This will not help eye bags. Those are not caused by muscle, and it's going to be a little bit of a different issue for you.
So what?
It's a different thing for eye bags.
What would that be?
Well, you might want to do a filler underneath there. Might bring up the cheek a little bit to get rid of the eye bags, or sometimes it's surgery. Okay, a couple of other places we can do Botox on people. Some people have what's called a constricted lip. She does not have it, but when they smile, their lip kind of curls up into their nose. You know, and there's 2 muscles here. One's here, and one's here. They come right off the anterior nasal spine. We can paralyze those, give a little bit of more of an upper lip, less of a gummy smile. We can treat gummy smiles with Botox. Corners of the mouth, if they're down, hers are not. But again, that tug of war between the muscles. If we weaken one side, the tug is. Now, where's a real, and I have just a tad left, and I'm going to do it for her. It's right up under here. This is the orbicularis. It's this circular muscle around the eye. When it gets around here, it's on its way down towards the crow's feet, and it's going to pull a little bit on these brows. Now, I've already put a little bit to avoid spot. I'm going to balance it on the top and bottom with just a tiny microdose unit right there. And that'll give her actually a little bit of a lateral brow lift, and it really opens up that nicely, and it's a nice way to do this. So just a tad.
Hey, Jenny.
There.
And if you guys want, Jenny also does Botox at the center who's watching.
Glad she's watching. Pay attention. So, and sometimes you get a little punctate bleeding. We'll just hold a little pressure there. So that's about 50 units. Well, I lost count. What was it? So,
How many minutes?
50.
50.
So, between the eyes and here, we made up the difference. But she's peeling from her tan.
That just means I had a good time.
It means we have to work on that for your skin. All right. So that's all it takes. And typically, we took our time there. It doesn't, usually we can get that done in about 15 minutes for you. We have instructions that we give after that. Now, the instructions that we give are pretty simple. We don't want you to exercise very strenuously today. We don't want you to wear a hat that's tight around here that could spread the Botox to places we don't want it. You could get some bruising, little punctate bruising at the site of injection. I don't think you will. By tomorrow you should be able to resume mostly daily activities. Now you won't see it start to work. It takes about 48, 72 hours to start to work. Takes about 7 to 10 days to get to full function, or full loss of function. And then it usually, like I said, lasts 6 months. We recommend you get redosed at about 3 to 4 months.
Okay.
How was that? Was it terrible for you, or?
Nope, it was easy.
Sweet. Now you can go back to work.
Right.
And that's it. So, any other questions?
Someone wants to know, would you be willing to get Botox done at spring fling?
Would I be willing to get Botox done?
Yeah.
I don't need it.
They want to watch you. Like, they want to know if you'll do Botox.
Oh, do Botox or get Botox?
Get Botox. Like,
Why would I?
the-
What does Jennifer think? What does Jenny think I need?
Things right here.
No, I'm okay.
Sure. Might be a crowd pleaser.
Well, we'll have to that will be a game time decision. It's like see, the doctors are the worst patients. You know, if there's going to be one person in the world who'll get a lid droop, it'll be me. So when you see me the Monday after spring fling, I can walk around. I have an eye patch on. It's because they got too much Botox in it. They will actually. I will not be able to move my face after they get done with me, and they'll think it's funny.
So we have a giveaway to give away.
So yeah, there's a giveaway. So I gotta stop talking. But yes,
So,
I might do it. I might do it if I get enough. If we have enough people at Spring Fling, if we have enough people, I would contemplate it.
Ooh.
That's not a yes. It's a maybe. A hard maybe.
So we're giving away a $250 Botox treatment. So that person's name is right there on that card.
Who drew it?
I did. I drew it with my fairy person.
How do you know who this is? Was it a drawing?
Yeah.
Kelly Ellsworth.
You are the winner of the $250 Botox treatment.
Is she watching this?
I don't know. I don't know.
Okay.
Well, hopefully.
Well, whoever that is, whoever put in for the drawing, that's it for Facebook Friday
Yep.
Live.
And you can.
So congratulations. That's a lot.
Mm-hmm.
That's what? How many units is that? That's a lot of units. That's good. That's what, 25 units almost.
Yeah. So and you can get
Good.
it done with Dr. Downs,
Congratulations, Kelly. Good
Jenny,
job.
or Sochi, or Kelly.
Good.
We have 4 nurse injectors you can get it done with. So or
Hey, let us know what you want to see on Facebook Live. We're open for suggestions. We want to be responsive to what you guys want to see. Botox is very popular. Again, take that to heart when you search out a practitioner who's doing Botox. Get somebody who knows what they're doing.
Yep. Cool. Anything else?
Good.
Happy
Have a
Easter.
great weekend. Happy Easter, everybody.
Woo! Guys, that's it for us. Don't forget to RSVP at Spring Fling if you're interested. This will be on special, and we will be demoing it through the night. So if that's something you're interested in, great time to come, ask questions. We do have multiple injectors that can do that for you. And again, the price is $13 a unit. We hope you have a great Easter again. Kelly, congratulations on the $250 Botox winner, and happy Easter to everyone. Bye!